Good evening, everybody, and welcome to the 7 o'clock talk. We're in our newly remodeled room, and I am trying to get this to not make you sick by swinging it all around and doing everything. But tonight we are going to talk about some COVID tips and tricks because it just keeps coming up. Actually, Jessica wants to take over and have a little rant.
Yeah, I'm just gonna rant
Go.
because I'm not quite sure. I just don't know. I just don't understand. And we've actually had 3 deaths of close family or friends. 3 deaths in a week of COVID, or not actually COVID. COVID related deaths because of their comorbidities, and they've all had heart issues, right?
So what's another disease that this is like? It's like you don't
It's
really die. You don't
It's
really
like the flu.
you don't really die of diabetes. You die of complications of diabetes.
Well, COVID is like the flu, and the flu complicates other things. I mean, I don't know. I don't know. I'm a nurse. He's a doctor, chiropractor, functional medicine, acupuncturist. I mean, there's lots of education in there, and we are passionate, so passionate about our patients and our friends and our family, and just taking care of people. Like, I'm not afraid. I've made house calls over the last month when everybody else runs from. We kind of run too, and anybody that's a nurse or a doctor, that's just what we do. But I get people calling me and they're like, "Oh, they died of COVID." And no, they didn't. And I've had friends and family say, "Well, they deserved it kind of because they weren't vaccinated." Well, who are we to make that kind of judgment? And that totally irritates me. I mean, why would anybody want ever say that? We're Americans, we're people, we get the right to choose what we do to ourselves. We do not get the right to judge others for what they think they should or shouldn't have done for themselves.
Judge not, lest ye be judged.
Well, and as a nurse, I've seen people with COVID in the ICU vaccinated. It's we just think this vaccine is the save all be all. And one, I'm pretty sure that it's actually killed people.
Well,
I
it
mean, I'm
has.
gonna
The
say, I'm gonna
VAERS has
say
already verified that.
it's yeah, but it's killed people that I've loved, and I'm just frustrated by it. So 3 people are gone this week. Well, we've had a slew of patients. I think it's just COVID has just come through like the flu season because we just seen it coming and then it just kind of moved through. But 3 people died. They're not old. They're in their 50s. They're or early 60s. They're not old. And they're like, oh, they died of COVID. Well, they died of a heart attack. They died of blood clots. That is related to COVID. And another heart attack. Okay, when are we going to take responsibility for our lifestyle, which means fast food, lack of activity, drinking bottles of wine? I mean, everybody has a vice, but we always overlook the vice that's ours. But you know what? Alcohol is a problem. Lack of activity is a problem. Eating too much sugar, fat, it's a problem. Like, when are we going to take accountability for our health? And I get so frustrated because we try to share. Now, I'm overweight. I'm stressed. I have a great diet. Do I ever eat junk food? Yeah, I'm snacking on tortilla chips. They're my vice. I love them, and but I don't eat them every day. And I don't eat ice cream, and I don't eat cake, and I don't do desserts. But you know what? Nobody's perfect, but it's all about moderation. But like we've just, oh, it's the COVID. Oh, it's the COVID. And I've looked at Trevor multiple times this week, and I'm like, this is so frustrating to me because we try so hard to educate. Like, where is the education? Do people just not know? Do you just like help us help? Like, do you just not know? Do you, or do you just not care until it affects You.
That's kind of like people who get to retirement age but never saved any money for retirement and then are broke because they just never thought it would come or would happen to them. And so the best podcast I have heard yet or seen yet was by Dr. Peter Attia, which is somebody who I admire. He had two guests on there, and it was podcast 189 of The Drive. So the podcast is called The Drive, and it was episode 189, and they talk about COVID. And they actually talk as much as I am anti-vax or I am stratify your risk. If you have antibodies, why do you need to have this?
And you aren't necessarily anti-vax.
Yeah, I'm not anti-vax. I'm just anti this vax, kind of.
Or actually, you're kind of
But
against people telling you that you have to have it.
Yeah, I've always been kind of bad about people telling me what to do. But they help you stratify risk. And in stratifying risk, then they kind of lay out who needs to be vaccinated, who doesn't need to be vaccinated, and they give you all of those things. So I really, really like that approach. The other thing to think about here is, I mean, you've heard us talk about this now for 2 years. Know your own risk. What is your HSCRP? And don't go by what the lab says, because what the lab says is not. A lot of these people that have died have been healthy and had normal lab values. You have to go what is off of optimal. That's the key, because then you're not inflamed.
And you've heard him talk about this for as long as we've done this. Hospitals are sick care. The lab values that they use are based off of sick people.
Well, it's off of the cohort, and cohort means the people that come in. So,
which are sick people.
So who goes to the hospital? The people that go to the hospital are, some of them are trauma, but usually most of them are really sick. And their numbers get averaged into the numbers to determine the labs. So those are considered quote unquote normal. And that's not, we can't go by that. And the other rant is, which dovetails beautifully into what Jessica has said, is we make it very hard in this society to be healthy. If we're going to subsidize food and we're going to subsidize health, then we need to subsidize real food. We need to quit subsidizing sugar in all of its forms. You can live without sugar. Your body takes whatever you eat and turns it into whatever you need for energy. So glucose gets turned into ATP. I am not saying never have a treat, because treats are okay. If your body is insulin sensitive, if you don't have hyperinsulinemia, you can take the hit. You can eat a whole bunch of sugar and it's not going to kill you. But there are actually studies out there that show that men die after men die of heart attacks. There's a huge correlation between high glycemic meals, last meals, heart attack. So this is all kind of interrelated. And we make it very hard. How hard would it be? And I'm not in the restaurant industry. How hard would it be to have whole real foods? The government subsidized that rather than this soy, corn, and wheat. Quit subsidizing only. We have to have more than three things to live. Just quit subsidizing those things altogether and start to actually subsidize the farmers that grow variety and tend to the earth, because that's what's going to bring our. I have yet to have a patient argue with me that our soil is not nutrient depleted. They all agree, and we live in a farming community. And so, if they're not going to argue this with me, then it's pretty common knowledge. We need, you need, we need to share this out. Tell people, hang through the rant. But the grassroots effort to make it easy to be healthy, easy to walk into a restaurant and get a pastured grass fed burger with unsweetened ketchup and onions. Perfect. It's really interesting. In the functional medicine model, it's variety. If you come in, we were listening to one today. They were talking about if you have a patient come into you and they have all these list of symptoms and they have all these IgG food sensitivities, then they don't have really all these food sensitivities.
Mm-hmm.
What they really have is a leaky gut, and their barriers are not where they need to be to protect them. And this increases inflammation. What's the number one killer in COVID? The cytokine storm. What is that? That is dysregulated inflammation. That is when the body just goes nuts and burns itself up. And that's what kills us with COVID. Everything that happens with COVID, the body can't fight itself. And these immune systems are all damaged. I mean, I'm 51. When I went to school, there were no peanut free zones. What is that? And now they have to be because these kids are so fragile because their systems have been so damaged. And even when we have kids, our children did not get the good bugs. I mean, if you were born in the 70s, you started to eat the highly processed foods, the high sugar foods, and it started to change and destroy your microbiome. You have to repair the gut. You have to remove the offending factors. If you don't remove the fast food, and I'm not saying you can never have fast food again, I still have a sandwich every once in a while. But
Shouldn't be the staple of your life.
yeah, it shouldn't be.
But
It shouldn't even be weekly.
It's just it's really about lifestyle. I'm really salty about it. I hate funerals. I hate losing people.
We're going to one.
I have I'm we are going to one. I'm going to skip the other two. But I'm tired of going to funerals because and I hear the COVID. What it's not about COVID. It's about what were you doing before you got the COVID.
Yep.
And Kathy, I'm sure that one person is you. And you get it because you've listened to us. But how do we help other people? I call a lot of people on a weekly basis because they all have COVID. And I'm Nurse Jessica, and although I don't practice at the bedside anymore, I'm still a nurse at heart. That's who I am. That's my thread that makes me who I am. I have to care for people. So if they need me, I'm going to go. If they need something, I'm going to get it for them. If they need help, we're going to figure it out. And so one got COVID, and then the other one got COVID. He's weathering it a little better than she did, but they did a great job. But I'm asking him because he's our friend. They're
our friend. There you
and
go.
so I can just ask hard questions and be like, we've told you stuff like this for years. Did you not know, or did you just not listen, or you just didn't care? And I said, how do we help people? Because he was the perfect person to ask. How do we help people? How do we share? Like, it's if you are in the hospital, if you go to the hospital because you're sick, then you've waited too long. And that's not about COVID. It's about diabetes, and it's this all these things. You're not just born with them usually, and you don't just one day have this. There's usually signs and symptoms, or you add up all of this until bam, here we go. But we preach it, we live it. It's our life, it's our passion, it's who we are, and we love to share. And yeah, we get the eye rolls and the eye pop, and oh my God, here they come. We're going to go this way. But we want everybody to be healthy, happy, and live a long happy. We don't want people to be afraid. You shouldn't be afraid to go out and enjoy your life with your family and your friends, and to adventure.
Well, we don't preach. People get to choose. I mean, people get to choose to be sick
But we share.
or healthy.
Yeah.
We'll say a little bit, but we don't sit here, oh my God, you're doing this all wrong.
It's not a judgment.
No.
We aren't judging. It's really about us wanting to give. It's not about, but I mean, is people just don't know? And if they don't know, how do you share it without isolating them or making them feel judged? Because we are burying all kinds of people that are young. These people have young children.
Well, we buried 30-year-olds.
Yeah, we have. And
everybody the age of Trevor.
And we're in our 50s. We're young. Like, you're not supposed to bury people until their 70s, 80s, 90s, 100. And I'm not even going to lie. I'm so salty about it because I'm tired of watching people drop like flies, and it can be preventable. And you know what? I'm a nurse. I'm vaccinated. I probably would have chose differently, but that's my choice. I chose that, and I would choose differently if I could go back, but we can't do that. And I never tell anybody they should or shouldn't. It is your right to choose. Some people should or shouldn't based on my personal experience and professional experience, but that's not for us to tell anybody what they can or can't do. We will share the absolute science or the up-to-date statistics, and we listen to all kinds of things, but like, how do we help others? Like,
well, so let's just, because we did say tips and tricks, and we've ranted for 17 minutes.
Yeah, because I'm just in a very salty mood about
so,
it.
Number one, if you're drinking soda, stop. Number one inflammatory thing, there's nothing good in soda. If you're drinking energy drinks, there's nothing good in an energy drink. If you want caffeine buzz, if you want that stuff, make it count. Use green tea, EGCG, that type of stuff. Black tea, black coffee. If you want, there was a great thing by Dr. Mercola and, or not Dr., but Dave Asprey, talking about ketones and getting your ketones up. Ketones are very anti-inflammatory, very immunomodulatory. So how do you do that? Time-restricted feeding, fasting. So these things, and there are studies that people who are fasting while they have COVID have better outcomes. And you've seen people in the hospital get fed but via tube, and they didn't do well.
So we started out when COVID first began. We started out with no food, because you should never feed people on a ventilator, because if they aspirate it, you just push it into their lungs. And so then but usually people aren't on ventilators that long. And if they did, we fed them via vein, not necessarily.
I thought you did a feeding tube.
We do. And then they changed that, and so they felt that they were suffering, or they weren't getting any nutrition. So then the protocol changed, and then we started getting them a NG tube, and we fed them. And then we had people aspirate.
But what do they feed them? I mean, when you get fed via tube, you're getting fed sugar. They feed you sugar water.
Sugar
water.
It's an Ensure, like a protein drink.
Ensure
basically.
is not nutrition.
And so what happens is, if anybody doesn't know, is if you're being fed via a tube and your organs aren't working, and things aren't moving through, it sits there until it can't sit there anymore, and then it comes straight back up, and then you aspirate it because you're vented. So it's going to be pushed right back into your lungs, and now you have a beautiful storm for a nasty pneumonia because you've got your air sacs full of
Aspirin.
sugar.
And so, good diet. You know, if you're going to come in and see somebody like me, just nail down a foundational diet. Try to get rid of, don't try, we've done it, get rid of all the processed food. She eats corn chips every now and then. I mean, yeah, have something around that you like to snack on. But if it comes in a package, box or can, if it has a UPC code, if it has more than 3 ingredients, throw it away.
Well, but
Otherwise,
it's
otherwise you can't come in on the backside and eat turmeric and eat garlic and eat onions and take, quercetin and take EGCG. The analogy is you're peeing on a 4-alarm fire, and it's just not enough because the hose that's feeding the inflammation is a lot larger than the hose you're using to try to put it out.
Well, and get moving. I mean, it's
The 4
really
pillars
simple. Just
to
move,
health.
move, de-stress, however you do that, and just be more aware. But the people that are listening know this because we tell you all the time. But how do we help others? I mean, we're really asking. Like I've asked this: how do we help others if they don't even know? They don't even know that there's a problem. Like they don't know.
So, other tips and tricks: eat real food,
Drink water,
coffee, water, or tea.
real water.
That's it.
And if you don't like water, it's probably because you don't like chemicals. Like if you don't like the way your water tastes, there's bottled water out there that's really good. Most of the time that people don't like water, it's because they taste like you're drinking somebody's swimming pool. So our water's like filtered multiple times.
RO.
And it tastes like nothing. It's so good. My children drink it by the gallons, literally.
I love
They
it.
love water. And if we go out and I take and get a drink of water and sometimes it tastes just like sewer.
So, some simple labs to throw in there on top of that: HSCRP, homocysteine, fasting insulin. Those are the things that you have to know. I mean, these are just baseline and they're simple.
And also, so I'm getting back to our little friend. Like he said he just didn't know. Well, his spouse actually ended up in the hospital, and we were like, she just kept going down, down, down. Ended up being undiagnosed diabetic. Then he was like, put 2 and 2 together. Huh, that's probably why she's tired. Could that cause sweatiness, irritability, headaches?
Yep.
So the signs and the symptoms are all there. And if we really think about our own self, just take yourself and think about how you feel on a daily, or how you feel like instead of your norm. Is your norm normal or is it abnormal? Like it's not normal to be sweaty and out of breath with a few little exercise. It's not normal to just be sweaty for no reason.
It's not normal not to sweat.
Yes, it also is not normal to not sweat. But this is somebody that has listened to us for years, and then he's like, I just didn't know. I just seen it on the daily, and
never going to happen to us.
They just agree it away. And so then he's like, wow, it makes perfect sense. But you don't know what you don't know. So how do we help others to know what they don't know in a kind, loving manner? Help us.
Thank you. Good night.